really big issue for them. So quite how that backlog is going to be tackled, given all the work with COVID, ongoing work, is going to be a really difficult one.
Hugh Pym, as ever, thank you very much for your time. Thanks for joining us on BBC Breakfast this morning.
It was just 10 months ago when we reported the UK's first coronavirus-related death. Since then, the pandemic has taken its toll on thousands of families. This morning, we're just going to take a moment to remember some of those who've lost their lives through the memories of their loved ones.
Christine Carmela Durbin, 61 when she passed.
My husband, Tim Emery, age 66.
My dad was called Richard Dossu. He was 72 years old.
This is Mum Anjana Ben Amin, 55 years old.
My great granny Rosemary, she was 87.
He was full of life, absolutely full of life. I fell in love with him straight away, which I know sounds a bit daft, but I did. We've only had 10 years really, but 10 wonderful, wonderful years.
He always wanted to help people, and everyone who knows him has got a story of something that my dad did to help them. One of the first songs that my Ishmael learned in the cathedral was "The Lord is my shepherd." And my dad loved hearing Ishmael sing it so much.
I just knew that my grandpa was there. This is my favourite photo of my great granny Rosemary. It was on my 10th birthday when we went to see a ballet of Swan Lake, and she saw us. Like, she was really happy to see us, and I was always really happy to see her. When she came down the hall and went into the porch, she'd go, like, she was really happy to see us.
Mum loves cricket. I think one of the best memories is the first time where me and Mum went to Lord's cricket ground. Yeah, she's given us the bravery like that to go do things that, you know, if we're scared, then she'll kind of give us the courage. Like Mum encouraged me to go backpacking, traveling. To be honest, what I am right now is wholly because of my mum.
With everybody, with friends, family, wherever she met, she was really, you know, made them laugh and made them feel at ease. She was extraordinarily charitable, shall we say, because, you know, if she had a last penny, she would give it to whoever needed it. You know, she would always make sure that somebody, whoever needed it, wouldn't go without. She was one of the best.
We're trying on BBC Breakfast this morning to reflect on that grim milestone of 100,000 deaths with COVID since the pandemic started. And you might be watching this morning thinking, you know, how do you find the words to say to a family member who's been through some of the things we've been talking about this morning, or a friend? And how do you find hope in the situation like we're all experiencing at the moment? And hopefully we'll be able to answer some of those questions in a few minutes for you. We'll be joined live on the programme by the Archbishop of Canterbury, Justin Welby. So
good morning, BBC London and BBC South East Today.
This botch, failing to account for lost gate receipts, has left many National League clubs in dire financial circumstances.
The Chelsea Flower Show has been postponed until September as a result of the pandemic. Organisers hope levels of infection will be much lower in the autumn and
it's between 5 and 8 degrees Celsius.
That's it. I'll have a final update for you a little after 9 this morning. Bye-bye for now.
Hello, very good morning to you. Welcome back to Breakfast with Dan Walker and Louise Minchin.
Every life that's been lost during the coronavirus pandemic after the official UK death toll passed 100,000.
Boris Johnson says he takes full responsibility for everything that the government has done, but has been accused by Labour of being behind the curve at every stage when responding to the pandemic. The UK's death toll is now the highest in Europe, the 5th highest in the world.
Bereavement support charities have written to the Health Secretary calling for more funding in the light of what they call the terrible toll of deaths from COVID.
It's 7:34.
Yeah, so the Prime Minister says, as we mentioned, he's deeply sorry after the UK's coronavirus death toll passed 100,000.
Let's speak now to a member of his government, Housing and Community Secretary Robert Jenrick, who joins us from central London. A very good morning to you. Thank you very much indeed for joining us, particularly today, actually. So we know 100,000 people in the UK have now died, every one of them, of course, loved by their family and friends. What is your message to those many who have been bereaved?
Well, I think it's hard for any of us to comprehend quite what's happened over the course of the last year. And COVID has affected everyone, but it's affected some people very profoundly indeed. And
says he takes full responsibility for everything that the government has done, that we truly did everything we could. Should we just look back at some of the things that have happened, and you can give us your assessment? We know that care homes were left unprotected, for example, slow to get sufficient supplies of PPE, late to lockdown at the start of the pandemic. How would you assess that? Would you say that some of those were mistakes?
Well, I'm sure that with the benefit of hindsight, you would say that some of the things that we did, we would do differently today. There will be things that we will look back on and be very proud on as a country on the day after this particularly grim milestone of 100,000 lives having been lost.
Can you admit now that there have been mistakes made?
Yes, as I say, I'm sure that when we look back upon this and make a considered reflection on the way in which we responded, there will be things that we will say we could or should have done differently. There will also, as I say, be things that we will conclude the UK did well, by that every decision was right, but they were very difficult decisions. There was no textbook, and I was in many of the meetings when those decisions were taken. Time and again, the Prime Minister and members of the Cabinet took the best available scientific opinion, him and others.
You say there's no textbook, but scientists were urging for lockdown in September. They were also urging again before Christmas. You allowed people to mix over Christmas. Since then, and that's just since Christmas, over 25,000 deaths. Was that a mistake? Do you regret that?
Well, it's not correct that to say that we allowed people to mix over Christmas. As soon as the Prime Minister and the government became aware of the transmissibility of the new variant that was seen in Kent in the final weeks of last year, as soon as that information was presented to the Prime Minister, he took the very decisive decision to change the Christmas plans of the country. It has proved a lot more transmissible than the COVID that we knew at the beginning of the pandemic.
It's going back to what you say about the new variant, and back to that point, scientists are urging for lockdown in September.
Well, that was before the new variant was discovered or its true transmissibility was known. Great variations in cases across the country, and the evidence, such as we know it is today, I mean, we will learn more, no doubt, with greater distance. But the evidence that I've seen suggests that the tiered system was starting to work. It was starting to control COVID as we knew it before.
Today about lessons learned, for example, over masks, over asymptomatic transmission. You talked about lessons learned. The government, the Prime Minister has talked about lessons learned. So, what changes because you've learned lessons?
Well, I think that what you heard last night from Chris Whitty was, to my point, that scientific opinion has evolved, responded to the pandemic. But I think that's something that we'll be able to reflect on after we're out of the pandemic. The focus of government has to be today, making sure the rollout of the vaccine continues at the pace we're seeing it today. One
of the constant criticisms from many quarters has been the government has been acting too little too late. So why only today is the government considering putting people from high-risk countries to quarantine in hotels?
Well, you're right to say we do want to take further action with respect to the borders. The Home Secretary will be making a statement to Parliament later. So it's right that I leave her to make that statement. Test. And then you had to quarantine upon arrival. we will be taking further steps now, which will tighten the regime further. People shouldn't be going on holidays at the moment internationally. They shouldn't be going on business trips.
Just to go back to the questions, if I could, why only today?
Well, we have been, the reason that we're going to take further action right now is primarily because of the emergence of new variants in other parts of the country, in other parts of the world, like the South African and the Brazilian variant. And of course, variants don't come into the country, or at least we slow the chance of them coming in. We're not a country that can be hermetically sealed. Across the border, there'll always be hauliers in their thousands crossing the various borders of the UK.
Mr.
So
Jenrick.
new variants will unfortunately be able to come into the country, but we can take further steps to slow it.
I just want to go back to something that the Home Secretary said. She said, on being asked, should we have closed our borders earlier? She said, the answer is yes. I was an advocate of closing them last March. Was it a mistake not to do it then?
I think it's difficult to make that judgment. There are different examples around the world. So the international evidence is mixed, but we have taken action on the borders. And as I say, later today, the Home Secretary is going to set out the next steps, which will add further restrictions.
Clear on that.
Will make it harder for the new variants that we're seeing elsewhere in the world to enter the UK.
Just briefly, will that be just people returning from high-risk countries, yes or no?
I can't give you that answer today, right now, I'm afraid, because the Home Secretary is going to set that out to Parliament. I think that's the right place for us to be making an announcement.
On a personal level, what do you regret?
Well, I think I've been involved in many different aspects of the response. Some things I'm very proud of, particularly the way in which we've looked after the most vulnerable in society, like the homeless and the shielded. But I'm sure that we could always have done more. I hope that we were learning lessons as we go along. I'm certainly, for example, with the vaccine rollout, paying great attention to how we can work closely with local councils so that we can make sure that some of the most vulnerable people in society do come forward. People, for example, from the BME communities and those from certain faith groups. I went to visit, for example, at the weekend, the first mosque to act as a vaccine centre in Birmingham, and was very inspired by the work that they're doing. But of course, there are lessons to be learned. I think one of the things that most affected me were the restrictions on people being able to go to funerals very early on in the pandemic, which was partly in the responsibility of my department. And we acted to change that so we could show greater care and compassion to people who were bereaved. We have to learn lessons, both within the response and afterwards, and we will do.
Mr. Jenrick, thank you for your time here on BBC Breakfast.
Thank you.
It's 7:47. You're watching Breakfast from the BBC. Reflecting on those lives lost, hearing from some of those who have lost loved ones, and we'll be speaking to the Archbishop of Canterbury about helping us all through this tragedy. Good morning, it's Wednesday, it's the 27th of January. Behind us are just some of the faces of the 100,000 people whose lives have been taken with coronavirus.
For every life lost, the impact on their families is huge. They were mothers, fathers, grandparents, sisters, brothers, sons, daughters, cousins and friends.
When we heard about the first cases of coronavirus back in January of 2020 and then reported the first death in March, none of us really ever imagined less than a year later we'd be passing this sombre milestone.
So during the next half an hour, we will be hearing from some of those who've been left bereaved by the pandemic and also asking what should happen next. Breakfast Jay McCubbin has been speaking to 3 families who have lost loved ones.
We've passed a devastating milestone. 100,000 lives. Immeasurable loss. Terry, a granddad for the very first time. Selena, a mother expecting her second child. Val and Heffin, foster parents, parents, grandparents. Here in a corner of Wiltshire, artist Bruce Monroe is creating a field of light to remember the dead. Each light, a life lost. And 3 generations are here to mourn: a husband, a father, a grandfather.
He used to rub my wedding ring. He'd sit and rub it with his finger, and I'd like him to do that. That would be lovely for him to do that again.
Terry and Jan had been married 36 years.
He always used to be there. When you walked through the front door, you'd be able to see him in the chair, and he used to just say, "All right, Kate." I miss that probably the most. He had a cracking sense of humour. He would always try and cheer you up with one of his jokes.
Selena, she had a big heart. She cared about everyone else more than herself. She loved kids.
Selena was a childminder, a vegan, super healthy, but also vulnerable as a diabetic.
She just wanted peace, love, unity, innit?
Val and Heffin had been married 47 years.
They were the life and soul of every party, always up on the dance floor dancing. They loved life and they lived life to the full.
They'd fostered 27 children, adopted 1. Val had been a carer, Heffin worked in the local hospital.
And they loved us hugely and we loved them.
A year ago, these lives were full of love and optimism and new beginnings. And then came COVID. In Warminster, at the peak of the first wave, Terry is rushed to hospital with COVID. His wife Jan, self-isolating, is told he has days to live.
When he left in the ambulance, I naively thought I could follow on. I wasn't allowed to visit him at all. I felt physically sick. I don't know, I can't describe it really. Just waiting for the phone call, waiting to hear something, and hoping perhaps they'd made a mistake.
In Warrington, Val is rushed to hospital. Her family's only contact is via text.
So I would just put, "I'm coming to hospital now, I've got some food to drop off." I said, "Keep us posted, love you." She texted me back, "Okay, love you too."
Unfortunately, the next morning at 10 to 3, I missed a telephone call off her. She was obviously ringing us to tell us that they were taking her down to be ventilated. And that will haunt me that I missed that call.
Days later, their dad is fighting for his life alongside his wife.
"Dad is now not far from you on ITU. Prayers are said for you and Dad every night by everyone. Stay strong. Please stay strong and wake up soon."
In London, Selena falls ill.
Selena was 37. She was 8 months pregnant, and obviously it was a massive surprise. She was one of the fittest people that I know. She was really struggling to breathe, Said in order for her to ease the pressure off her lungs, we need to do a cesarean, take the baby out. Before they did that, she was induced, so she gave birth without meeting her, basically.
Within days of hospital admission, their world falls apart.
She was on a ventilator for like 12 days. And then, yeah, she passed. Multiple organ failure. She never got to give the baby a hug, never got to have that first skin-to-skin contact. It didn't make sense.
So we had Dad's funeral. And the following day, the morning, I got the telephone call to say that there wasn't anything that it could do for Mum.
I'm just sorry that I wasn't with you.
So many people died alone. So many more grieved alone. And this is a tribute to them all.
Individual spirits of the people who have died and left us in these terrible times. They were people who were very much loved, and they loved people themselves. And this is this is really their love living on.
We didn't have a chance to say goodbye, and this maybe is a way of reaching out and saying goodbye, because I do feel he's here. I do feel he's close to me.
100,000 deaths, hard to visualise. This is what 1,000 looks like.
You feel cheated and robbed and angry that it's happened. There's people out there that are dying every day, and they shouldn't, they shouldn't be.
This is what 10,000 would look like.
I was really angry at first that they'd been allowed to catch the virus. But now, 10 months down the line, people are still losing their lives, and it's just heartbreaking.
This is 100,000.
One of the worst death rates in the world. Was it all necessary? Some of those people, could they have been saved? I'm sure lots of them could.
At the start of the pandemic, Patrick Vallance, the government's chief scientific advisor, said keeping the death toll below 20,000 would be a good outcome.
Until you've actually gone through it yourself, or you've experienced someone in your family, or it's your mum or your dad or whoever it is that's passed from it, you're going to look at it differently.
I really want the families who've lost their loved ones to realise that we as a country, as a world, are behind them.
They had massive hearts, which is why they're so missed. And we just hope that we're doing them proud.
Her name's Love. It's actually a name that her mum picked out for her before she passed. She's 9 months now, happy, healthy, content. Her name is Love for a reason. Listen, she's the biggest blessing ever.
And it goes without saying thank you to all those families for sharing their memories about their loved ones with us here on BBC Breakfast. And they are just, of course, a handful of those who have been directly affected by what's happened.
It's just gone 8:30 and look at the faces behind us. It's a number almost too big to comprehend. More than 100,000 people, all taken from their families and friends since the start of the pandemic just a few months ago.
We reported the first UK coronavirus-related death in March. Since then, we've seen the numbers rise to a level which, back then, seemed unimaginable. The UK now has the 5th highest number of coronavirus victims in the world.
Behind every name are families and friends still trying to come to terms with what's happened. Many have been unable to say goodbye properly.
And we'd like right now to pause for just a moment of reflection and remember those who've died.
And we're joined this morning by the Archbishop of Canterbury, the Most Reverend Justin Welby. Thank you very much for being with us this morning. Every death we know hurts. We've heard many stories this morning over the last few weeks as well. 100,000 seems like a huge figure, doesn't it? Hard to get your head around. I wonder whether you could try and help us this morning as a nation try and come to terms with that sense of loss.
I think you're doing it in exactly the right way, and your contributors earlier were doing it in the right way. We have to think of 100,000 individuals, 100,000 families, 100,000 people who had friends. There's millions who will be affected by that number, but each of them is of infinite value in the sight of God. And then say sorry. We left on bad terms last time we met. I never expected that we wouldn't meet again, etc. All those sorts of things. So for the individual, where there's a genuine cause for regret, take it to God. confess it. Confess it to a close and loving friend who can trust you. Walking in the light means we look at what is really there. We acknowledge it and we let the light and love of Christ heal it and bring us new life.
We appreciate your time this morning. That's the Archbishop of Canterbury, Justin Welby, speaking to us live on BBC Breakfast this morning.
And thank you for so many of you getting in touch with us this morning about what we've been covering this morning in the programme, and really just, it is a day for reflection, isn't it? 100,000 deaths, and thank you for being in touch about that as well. Listen, it's really wonderful to speak to you. Thank you very much indeed, and we'll tell everybody about the programme.
It's always a pleasure.
Oh, thank you. Craftivism Making a Difference is on BBC4 Monday 10 p.m. It'll be on the iPlayer as well. Thank
Who
you.
doesn't love marmalade? We are back tomorrow from 6 o'clock in the morning.
She was giving us a big wave. Now on BBC One, it is time again for Morning Live with Gethin Jones. Morning to you.
Morning.
Morning, thanks, Lou. How about... Hello, good morning. Zand. We're waking up to the news that the UK has lost more than 100,000 people to COVID. It's obviously tragic, it's hugely sad, it's a sombering moment, isn't it?
It's massively sombering. I mean, I think you try and imagine that number of people. 100k is such a sort of harsh statistical round number, and yet every single one of those people is an individual with people caring for them, looking after them, and they're people who have gone before they should have done.
You are not alone. Whatever this year brings, we'll face it together. The future's not cancelled.